So my experience with public funded sexual health clinics when I was a young person was non-existent. I didn't know they existed. So back in the early 80s, I was unaware of how to access sexual health. And so I think they're a really vital part of a young person's holistic health. I think the lived experience of a young person now around their sexual health is very different to 30 years ago. There's obviously a lot more sexualisation in our media, and concurrently and paradoxically quite a morality around talking about sex frankly and openly with young people, and I find that confusing, and I think young people find that confusing as well. So it's about being sex positive, normalising sexuality in all its wonderful diversity, and encouraging people to be informed about the sex and the protection they may or may not choose to take when they have fun. I think young people in all their diversity have all different sexual health needs. They come from all different families and they have all different needs. There's lots of arguments about whose responsibility it is to support young people around their sexual health. Is it the family? Is it the state? Well, sometimes family of choice, carers don't have that capacity to support young people because they didn't get that information. So it's like an intergenerational denial, if you like. If you're lucky enough to have a family that is there to support you, those conversations can also be awkward. Who wants to talk to their parents about sex? So that's where I think innovative and interesting, usually peer-led projects and education are probably the most effective, because who wants an old person to tell you what to do or to know about what you're doing? So I think it's that balance between confidentiality, exploration and information. My fantasy is that sexual health centres become really colourful, fun places that might be embedded in existing services so that young people can rock up for a bit of a chat with someone if they're having a few mental health issues, and maybe just down the corridor they can nip in and have a quick, painless, fast, confidential sexual health checkup. So fun, easy to access and normalised.